My name is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, Treatathon, the Lupus Day. Last week I had 4 different patients. Their average age was between 15 to 21 years old. And they are all boys, and they are serving, as they are working for different businessmen, different masters, different businessmen. So the injuries they had ranged from ruptured tympanic membrane, dislocated jaw, excessive, marks from flogging, and then of course I was also treating 3 of them malaria. So each time I asked, of course they were brought by different people. So each time I asked any of the guardians what led to maybe the rupture of the injury to the ear, they would tell me he's stubborn. I'll ask the other one, they will say he's stubborn. So I was not like, because there is, in this aside, there's a way they explain stubbornness. And so I was not like, I want you to break down what kind of stubbornness that will lead to this kind of injury. That is, how stubborn will a boy of 16 years be that will lead to you slapping him continuously till you perforate his tympanic membrane. And they were not like, sometimes you'll be talking to them, they won't be responding. If he can, almost for about 1 minute, or you finish telling him something, he will say, please repeat. Or you finish talking to him, he will say, I don't understand. Or you will send him to do something, he will forget what you sent him to do something to do. So from the pattern of the response the caregivers were giving me, I discovered there was something peculiar about these people's illness. Now let me just briefly tell you about Apprentice, the apprenticeship down here in the southeast. Apprenticeship is just like a way, it became very common after the war, when most of Igbos were treated as second class, in fact as 20th class citizens in their own country, because they were taken as people, even though Gowon declared no victory, no vanquish, but it was just on paper. The Igbos were taken as people who are defeated. So there was no more civil service, there was no money, there was all the universities in the southeast were bombed and destroyed, and no new ones were coming up. So the rich Igbo men who were in businesses now started taking up younger guys. So they would train them in that their business, and after training them for maybe at most 5 to 6 years, 5 to 7 years, they will now do what is called iduhuno. They will now set up a similar business for them, give them some money to start their own. Those people that they set up will now pick up younger ones. When they stabilize, they'll pick up younger ones. So that is what we call apprenticeship. And all these boys are listed for you now as my patients. We are all apprentices of the men that brought them. So now the advantages of that apprenticeship is that it was able to create so many billionaires within a short while, because it helped raise families from 0 level of poverty to 1,000 level of wealth. In fact, it was what helped Igbos stand back then. Now the disadvantages is you might fall into the hands of a fraudster, or a wicked person, or a good man married to a Jezebel, or a good man married to a feminist who believes that no man should ever be in fact, no man should ever stand, no man should ever be stable. So if your master has such a toxic family, or your master is a wicked person, or your master is a fraudster, you will make all those your 5 years a waste. You will end up not stabilizing you, not setting up your own business for you, or he might accuse you falsely of one thing or the other, or he might beat you so much that you start having this kind of injuries that my patients were having. So now let me now come down to what really was happening to these people. What was happening to these people is what we call seizure. What is seizure? Seizure is a sudden, uncontrolled burst of electrical activity in the brain. Sudden, uncontrolled burst of electrical activity in the brain. That is what seizure is. Now, for you to understand seizure very well, I will divide it into epilepsy and non-epileptic. Epileptic seizure is a seizure that has occurred more than once and doesn't have a trigger. Epileptic seizures are divided into idiopathic and symptomatic. Idiopathic has no cause; it just happens. Even if you keep tracing to find what is the cause, there will be no cause, no familiar cause, no disease, no nothing. While symptomatic normally presents with a cause, and it's normally common in neonates and elderly. Those symptomatic can be as a result of trauma to the head, or vascular issue like hypertension or stroke. Then we have non-epileptic seizure. Non-epileptic seizure, they have a cause. They're normally as a result of head injury, encephalitis, brain infection, encephalopathy, and then infections. Things like those common ones that we call febrile seizure that normally happens in children, they are all examples of non-epileptic seizure. Now, let me now also go to, for you to understand the kind of seizure happening to these people, I would have to classify seizure into focal or partial seizure and generalized seizure. Focal or partial seizure and generalized seizure. Now, focal seizures happen at a part, of course, majority of seizures, almost all seizures happen in the cortex of the brain, in the cerebral cortex. So, if this seizure happens at a particular area in that cortex of cerebral cortex, and does not generalize and does not spread, it is called focal seizure. If it happens at a particular area and from that place spreads all around the cerebral cortex, it will be called generalized seizure. So now, as I have explained this thing for you, let me now come down to this my patient. Remember what I told you about the apprentice that their masters brought, and they were exhibiting, and the masters said they were exhibiting certain signs. They'll be quiet, they will be forgetting, they will be, sometimes they will stand at a spot. Let me now tell you why I suspect those teenagers were suffering from seizure. Just that their masters didn't understand and they mistook it for stubbornness, and we are beating these people. Okay, so first I will start with focal. These children might be suffering from focal seizure, and focal seizure has two types of seizure. It has focal impaired seizure, impaired awareness seizure, and focal awareness seizure. Focal awareness seizure is the one we call simple partial seizure, while focal awareness impaired seizure is the one we call complex partial seizure. Now, for the simple partial seizure, the presentation is normally, the focal seizures normally have an aura. Aura means something, they will be exhibiting something, the patient will be feeling something as if there's something about happening, with some little other signs. So, for simple partial seizure, an example of simple partial seizure are Jacksonian seizure and epileptic partialis continua. So now, in this simple partial seizure, the patient is aware, is fully aware. There's no loss of consciousness. He's aware it is happening. He can just start with twitching. Maybe one finger will be doing like this, or the leg will be doing like this. The patient will know it's happening, just that he wouldn't be able to control it. So you just discover that he cannot control a finger, the finger doing like this, or the one hand doing like this. It just happens at a particular part of the body, and it will be doing like that. Now for Jacksonian seizure, it can be doing like this. It can start with like this, and from like this it will start like this, from like this it will start like this, from like this it will start like this. But the truth there is that it never generalizes. Like immediately it lives here, it doesn't. This place doesn't. This place stops. This one continues. So that one's the Jacksonian seizure. Then epilepsy non-partialis continua means that the epileptic partialis continua means that the twitching is now happening repeatedly. Like it can happen now, after 2 seconds it can happen again, even though it's just small, it just keep happening like that. That is about simple partial seizure. And just like I told you, there's awareness. The patient is fully aware. The aura is normally epigastric. The patient is feeling like nausea, feeling like vomiting, feeling like abdominal pain. Then it happens. Then the next part of seizure that might be happening to these people is a complex partial seizure. That is the focal awareness impaired seizure. In focal awareness impaired seizure, there is aura. It lasts greater than 30 seconds. There is associated post-ictal phase. That is after the seizure, something else happens. There could be post-ictal amnesia. The patient might not remember that those things happened. Or there could be post-ictal thought paralysis. Or there could be headache. There could be weakness. So now, in complex partial seizure, the aura is normally epigastric, especially if the seizure is affecting around the temporal lobe, like the parieto-temporal lobe. There will be signs of epigastric like increased salivation, increased nausea, desire to vomit. Then if it happens, if the seizure is about starting at the visual area, there could be impaired there could be impaired vision. Then what are the signs the patient may present? The signs might include lip smacking, swallowing, and chewing. Then the patient might be fumbling. Now, this patient does not know he's doing these things. That's the difference between that one and simple partial. But the patient is conscious. Now, the patient cannot respond. If you are speaking to that patient at that moment, the patient will understand, but cannot respond. But can still carry out instructions. Like if you tell that patient, get this thing for me, the patient can get it. More like behaving like somebody in trance. The person can get it, but he's still not aware. But will still follow that instruction. In fact, some of them can even drive. They can drive at that, and it's risky, but they can drive at that point without still knowing that this is what they are passing through. Now, after that seizure, when that seizure stops, the patient might not, if you tell the patient, do you know you are doing this? The patient will not know he's doing that. That is why the awareness is impaired in that particular case. Okay, so let me now go to another one. I'm going down to generalized. Now, in generalized, the particular seizure I picked in generalized consists of so many other seizures like tonic-clonic seizure, grand mal, and others. But I'm going to pick only absence seizure. In fact, there's typical absence seizure and atypical absence seizure. I'm picking typical absence seizure. Typical absence seizure now will also be one of the seizures that might be happening to these teens. Now, in typical absence seizure, if I'm explaining typical absence seizure, you might be like, is it not this same? Is it not complex partial seizure you're repeating again? But that is not it. In typical absence seizure, it's not generalized. There is no loss of consciousness. There is no jerking. Remember, absence seizure is part of generalized absence seizure, but there's no jerking. There's no loss of consciousness. Patients, it happens just it just takes a particular part of the body too. There is in this particular one, there is no post-ictal phase. It just happens less than 30 seconds and stops. The patient doesn't even know it happened. It can start. It does no aura at all. So it is abrupt. It just happens, bam, very sudden. So the symptoms include something like fluttering of the eyelids, twitching of the facial muscles, and staring into the sky, just staring into the empty space for about 30 seconds. It will stop. So if you notice it and tell the patient, do you know you just did this? The patient will not know. There's no post-ictal phase at all. The patient will not know that kind of thing ever happened. And there's no aura, just like I've told you. So this is, imagine this happening to your apprentice. You would think the person is being stubborn. Now, the other seizures that might be happening to these kids, these teens, might be what we call juvenile myoclonic seizure. Juvenile myoclonic seizure involves myoclonus, just the muscle, the child jerks, and then it stops. There is no stiffening like in a grandma. Another one is atonic seizure. In atonic seizure, there will be the child just suddenly loses. In fact, it's one of the most dangerous seizures because it can lead to head injuries. It can fall anywhere. It can fall as the child can fall. The thing can fall as he's crossing the road. It can fall as he's operating a machine. So the body just generally loses tone of the muscles. That's the muscles just become flaccid and the person drops. In fact, I think that's what's called drop attack. The person just falls. Then we have atonic myoclonic seizure. Myoclonic atonic seizure. The patient jerks and then becomes flaccid suddenly. Then the next one we have is a post-ictal seizure, that's after the seizure. We have what we call post-ictal amnesia. It can be one of the things that's happening to these people because the man they are complaining that they will not remember anything. So during that post-ictal phase, if maybe you met your apprentice during the post-ictal phase, whatever you are saying, he won't understand because he's still trying to recover. That can be part of the things that's happening to these people. Next one is thought paralysis. Maybe you met him after the seizure during the post-ictal phase, and part of the body is not working. You now say the child is demon. Yes, they were also saying they were demon possessed. You now say the child is demon possessed because one of the part of the body is not moving very, very well. You now say this child is likely possessed. So those are the things, those are the problems these kids might be coming down with, and people were calling them. People were saying they are stubborn. Okay, now so what are the likely ways we can conditions that can cause this in that home? Most of the things causing this seizure, these children, are from their masters. Let me list them for you. Sleep deprivation. Most masters are so cruel, or their work is so tedious that they deprive this apprentice from sleeping. Next one is excessive stress. Infections, poorly treated diseases, poorly treated fever, decreased oxygen, excessive playing of video games, sounds that are repetitive sounds, low sugar, maybe they're not being fed very well. If the person is taking drugs, maybe hypertensive drugs. If the person is abusing drugs, if there's head injuries, or if the person is abusing alcohol, all these things can lead to seizure. Then the next one is how do we help these people? So these are the things that will help a doctor and also help any caregiver, any health caregiver, to manage any of your apprentices that is coming down with these diseases. So these are the things you should find out. So because the questions I'll be asking you is, how fast did the episode start? Did it start abruptly, or did it take a while? Was the patient exhibiting some kind of characters before the seizure started? Was there any abnormal body movement? Was the patient's body moving anyhow? Was there checking all those stuffs? Or was there any abnormal behavior like staring into the sky, all those stuffs? How long did that episode, that seizure, one singular of the seizure episode last? Was it less than 30 seconds, greater than 30 seconds? How quickly was recovery? Was it, did the patient recover immediately after the seizure with no postictal phase, or was there series of events during the seizure? Then the questions I will expect you to find out from the patient, because these are questions I'll still ask the patient, that is your apprentice, is: was there a premonition or warning like aura? Was there a trigger? Remember we said epilepsy has no trigger, while non-epileptics have triggers. Was the trigger like flashing of light or repetitive sounds? Was the child ever had meningitis or any kind of brain infection before? Was the child into use of drugs? Is the child being managed for seizure before but refused to take his drugs? Is there family history of seizures? Then we'll go into blood test. We'll do some little blood test, check the level of the drugs, if the patient has been taking drugs, whether the level is okay, and check whether there is any other infection, all those things. You can even also do lumbar puncture if you're suspecting about brain infection. Then we can place the child on some drugs, and it's important, we can, in some cases, we can also put like a bracelet, so that if something like that happens, people will know that this is this. Then, as a medical doctor, whenever a child is having seizure, the child needs your help. Whenever you discover any abnormal behavior in the child, don't beat the child, don't hit the child. Be very observant of any child around you. What do you do? If it's not a generalized seizure, calmly help the person sit down or lie down so that the person takes time, recovers. If there's generalized seizure, protect the child's head. Don't put your hand inside the child's mouth, and then turn the child immediately. The seizure stops. Turn the patient into a recovery position. Lie on the left and allow so that the patient breathes very, very well. Don't be hitting the child. Don't be praying don't be punching the child. Don't start pouring holy oil into the child's mouth. Then when you now come to hospital, we administer some drugs and medication. So seizure is not really that. Seizure can appear very scary, but it's very, very easy to manage, and people rarely die from it. Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, treater, the Blue Day.